Before the first treatment session, clean the skin and assess the treatment area considering the patient's skin type, tanning, tattoos, beauty marks, etc. Perform a skin test before each treatment. Make sure that the operator and patient are fitted with the correct eye protection for each application. In order to set the correct parameters for your patient, perform a skin test at the beginning of each session. Pulse a few shots on a small area and assess the skin reaction after a few minutes. Note that patients with darker skin types may have a noticeable response only 1 to 2 days post-treatment. Set treatment parameters according to the table shown here. Dye VL applicator can be used for skin types 1 through 4, dye SR up to skin type 5. On the screen, set the fluence according to skin type. Skin types 1 to 3, 3 to 4 joules per square centimeter, and total energy 3.2 to 4.3 kilojoules. Choose 30-second interval time and 100% cooling. Treat until reaching the required total energy in kilojoules. Use protective eyewear for both the operator and patient. Mark 100 square centimeter grids using a white pencil. Spread a layer of ultrasonic gel or spray on the area. Place the tip perpendicular and in full contact with the skin, then press the foot switch and move around the area using the in-motion technique. The pulses will stop after 30 seconds. During the pause, continue pressing on the foot switch and move the tip on the skin for cooling. The pulses will resume after a 6-second pause. Continue until you've reached the total energy requested. During the treatment, the patient should feel a slight stinging heat sensation, but not too strong. If the heating sensation is intense, release the foot switch and continue cooling the area with the tip. Treatment endpoints: vessels reddening or darkening, mild erythema and darkening of the pigmented lesions. Post-treatment: cool the area. Apply emollient cream and sunscreen on the treatment area. The treatment may be performed on any body area with sun damage, such as the chest, face, hands, and arms. Advise the patient of post-treatment instructions: not to scratch the treatment area, 2 weeks without sun exposure before and after treatment. Superficial pigmented lesions, the clinical procedure, dye VL or dye SR applicators, stationary mode. Mark around each lesion with a white pencil. Set treatment parameters according to the table shown here. Set the fluence 10 to 12 millijoules for 1 to 3 with pulse width 10-12 milliseconds and 75 to 100% cooling. For darker skin types, reduce fluence. Start treatment. Use protective eyewear for both the operator and patient. Press on the green standby button to start treatment. Apply gel and use the template to demarcate the lesions according to the size of the lesion. Place the applicator perpendicular on the template, then press the foot switch. Look for mild darkening or reddening of the lesion. If no response, increase the fluence by 10%. If the response is excessive, then reduce the fluence. Treatment is performed in 1 to 3 passes. Treatment endpoints: darkening or reddening of the lesion. Patient may feel some burning sensation. Post-treatment: cool the area, apply emollient cream and sunscreen on the treatment area. Advise the patient of post-treatment instructions: do not scratch the treatment area. Instruct the patient to avoid exposure to the sun for 2 weeks. For the body, divide the areas into 450 square centimeters using power of 50 to 70 watts and total energy 36 to 63 kilojoules. Set treatment parameters according to the table shown here. Start treatment. Use protective eyewear for both the operator and patient. Apply mineral oil on the area. Place the tip perpendicular and in full contact with the skin, then press the foot switch and move around the area using the in-motion technique. Reach a temperature of 40 degrees Celsius on the skin, then start to accumulate the requested amount of energy. Patient should feel a comfortable heating sensation, not too hot. If the heating sensation is intense, reduce the power by 10%. Treatment endpoints: heating of the skin with erythema and slight edema. Post-treatment: clean the skin and applicator from the oil. 5 to 7 days without sun exposure before and after treatment. Treatment for large areas using SHR mode. Mark grids on the area of 200 square centimeters with a white pencil. Set treatment parameters according to the table shown here. On the screen, adjust the fluence, expressed in joules per square centimeters, interval time, cooling, and total energy, expressed in kilojoules. The treatment time per grid will be expressed in seconds. Start treatment. Use protective eyewear for both the operator and patient. Apply ultrasonic gel or spray. Place the applicator perpendicular and in contact with the skin, then press the foot switch and trigger, and move around the grid area using slow in-motion technique. Continue until you've reached the set to cumulative energy, and then move to the next grid. If the patient experiences any discomfort during treatment, reduce the fluence by 10%. Treatment endpoints: erythema, hyperemia, parafollicular erythema, and edema. Instruct the patient to avoid exposure to the sun for 3 to 5 days. Number of treatments: 6 to 10. Treatment intervals: 4 to 8 weeks.